Let's dance in style, let's dance for a while. Heaven can wait, we're only watching the skies. Hoping for the best, but expecting the worst. Are you gonna drop the bomb or not? Let us die young or let us live.
So we all wish to be forever young, and some of us are, you know, right, Nefrit?
I am.
Right, but wrinkles can put a damper on those plans. Dr.Arusha Campbell-Chambers of Dermatology Solutions is here to tell us some things we may not know about these fine lines and how to deal with them. Well, Doc, morning.
Good
Morning,
morning.
welcome.
Thanks for having me.
If indeed you're right about some of the ways that we get these wrinkles, then we're just all going to be wrinkled. Because that means wrinkles mean you're having a good life. Laughing, smiling, expressive.
Right. It's to each his or her own. Wrinkles are a natural part of the aging process. There are actually two different types of aging. Your natural aging, that is internal aging, that's due to your genes. So people may differ in how they age because of their genetic makeup. And then there's external aging, which is also called premature aging, based on the environment and your lifestyle. The sun is the #1 reason why we age. It accounts for about 80% of our aging, no matter what complexion.
What?
So yes, it's true that fairer skin types tend to age more rapidly because of that, but all skin types do get aging. Other things like cigarette smoking, stress, sleeping on a particular side can cause lines to form in that particular area. So it's really good to try sleeping on the back if possible. You know, if
Now your back now get rid
excessive facial expression. So people who are very expressive, you'd find lines forming, frown lines, laugh lines, and so on. There are many different factors that contribute to these wrinkles.
Let's talk about that 80% caused by the sun. That's
Sure.
where the SPF and the... So we really ought to put these things on.
Certainly. We're trying to get the message out there that we need to be using sun protection for wrinkles, but also for things like skin cancer, which even though it's less common in darker skin types, it still exists.
Well, I'm in trouble because I'm a football coach in a serious way. I
Right.
don't wear caps unless it rains. And I actually want to get dark, so I stay out there as long as I can stay
Why
out
you
Right.
want to get... You're always tanning?
I actually want to get very, very dark, to be
Right.
honest.
Tanning is actually a sign that your skin has been damaged. So it has been glamorized in society. But it actually is a protective measure that the skin uses to protect itself from further sun exposure. So simple things that you can do, you should really try to use a sunscreen every day of SPF at least 30 or higher. Above 30, you don't get that much added protection, right? And then it doesn't last all day. So if you're going to be out in the sun and sweating and so on, it doesn't last longer than, say, 2-3 hours.
So you should
ideally, you should reapply.
Yeah, but don't they say that the sun is also good for the skin?
The sun is good for the skin, but the amount of sun that we get, you know, is adequate to give us, especially vitamin D. It helps us produce vitamin D. And you also get vitamin D through your diet. So the idea is not to stay lying in the sun just to get vitamin D.
So 2 hours a day, say 4 or 5 days a week, that's too much?
It depends on the intensity of the sunlight. So you want to avoid that strong sunlight between 10 and 3. And you want to, as you said, wear protective clothing where possible. You know, the hats,
caps,
long
stuff.
sleeves, those kind of things are also good. Even through when you're driving, through the
Yeah,
car
let's
window.
talk about that. You're saying we're at risk even in the car?
Even in the car. So people tell me all the time, but Doc, I'm not in the sun. I'm in the office from morning till night. But even when you're driving, especially the side that, you know, that you're right by the window, the sun can actually, the UV rays can actually pass through and cause aging.
All right, we have some points. That was one, so we finished with that one. Your family tree can tell you a lot.
Yes, I mentioned your
Yep.
genetics.
Okay.
So you look at how your mom ages, how your dad ages, and
Right,
that's kind
and
of
that
an
can give you,
indication of...
certainly.
Okay.
Yep. Switching up your diet may ward what off?
Right. So the good old fruits and vegetables, they're not just good for your heart and other things, but they're good for your skin as well and delaying aging because they have a lot of what we call antioxidants. And these are substances which help to prevent the damage that the external
By the
factors
way,
cause.
can they be reversed?
Well, that is a very good question. Prevention is always easier and better than cure.
And less costly.
So right. So the preventative measures are definitely better, but there are a lot of things that we can do. If the signs of aging bother the individual, there are lots of things that we can do to help with the
Without
wrinkles.
plastic surgery and all.
Precisely. Everything is not for everybody.
Right.
So there are many, many different things from, now topical products are going to go only so far because the damage that's done is really in the middle layer with your collagen, elastic tissue, and so on in the skin that contribute to the sagging and different signs, the wrinkling and different signs of aging. So you need deeper procedures usually to get it. So like Botox. Botox has gotten a bad rap. No, I see you wrinkled your face. It's gotten a bad rap in the press because in Hollywood it's taken to an extreme. We've used it's very safe. It's FDA approved, which means it does what it says it can do, and it does so safely in trained hands.
What is it that you're injecting in the skin?
Right. It's a purified version of a derivative from a bacteria that is injected, but it's all purified in very tiny doses into specific muscles to help weaken them. So the idea is not to get a frozen look, but to just look like a soft.
Surprised.
Right. No, that's not the idea. That's what not to do.
Well,
just to get, because some people it really bothers them if they look constantly frowned, constantly angry. And it's surprising what you can do by just softening it up to help improve that.
Well, I think everybody knows that I'm an old man. I'm 62. And in a serious way, just a couple of weeks ago, my makeup artist said to me, if I lotion my face, which I...
so that's
she said my neck. I don't know what she saw, but she said I should be doing it like up or something like that.
Right. So those are simple measures that because the drier your face is, the more obvious the wrinkles appear. So if you can be more moisturized, that can help soften it. Now that's going to soften probably the very fine lines, but not the very deep wrinkles.
That's the regular lotion that you use anywhere else on your body? Or no?
Not quite. There are other moisturizers that would have in other ingredients, like remember the fancy things I told you, the antioxidants and so on, and the SPF that would also help. There's the latest procedure that we have for people who don't want Botox and fillers and so on, to get a more natural way, is actually using your own plasma from your own blood. I know it sounds a bit scary, but what is injected is like a clear yellowish substance injected into you to get your natural growth factors, and that helps to stimulate your skin to, you know, reduce aging. There's chemical peels, microderm, lots of
The final one I want to ask you about, and a lot of people probably don't realize it, that frown lines may mean vision problems, because when you don't have eyeglasses...
Certainly. If you're not seeing very well, you'll naturally be frowning and squinting, okay? And that can then lead to those lines forming and just being perpetually there, and then you have this constantly angry look, and people are like, oh, you look so white, you know, and really, it's just because of the constant expressions that you
can relate to that, eh?
Yep.
So get your eyes tested if you think
where is
that's
Dermatology Solutions?
Okay, we're located in Montego Bay in the Sagicor Montego Bay Commercial Center on Howard Cook Boulevard, and our numbers are 378-8740 and 979-0414.
And I guess you do much more than wrinkles.
Certainly, and we do all skin, hair, and nail problems, and we also have other specialists that come in our skin, hair, and nail, and skin, mind, and body clinic and institute. You know, where we also are going to be training people in different procedures and so on, and have other specialists on board.
Okay, well, I'm Botox.
Drink a lot of water is the other one.
Certainly.
And use face creams to help you maintain a glow.
Botox.
Would you try it?
I just taste it.
No, seriously, would you try it?
Probably not.
Why not? It's safe.
It's quite safe.
How about we do? No joke, Kadish. I'm volunteering now to do a before and after shot. Before Botox. I mean, everybody knows you look 35. But what would you look like were you to just try the Botox? You could look 26. Would you try it?
You couldn't volunteer Omawale.
No, Omawale. No.
All right.
Yeah, my feeling about these things is that it depends on the individual and what bothers them. But there's a lot of things that we can do because everything may not be for everybody.
I would love to do that. Let's do that.
You do it? It's quite safe.
All right. Okay, we're volunteering him, Doc.
All right, let's do it.
All right. Dr.Arusha
Campbell-Chambers of Dermatology Solutions.
Jinx, stay with us, folks, because after the break, we're going to get a taste of the upcoming Rainforest Seafood Festival. Plus, we might just have a giveaway for you as well. Stick around. Smile continues after the break.